Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing clinical aspect of Rasa Vichar and we have completed Madhur Amla Lavan Rasa. Now we will move towards the Katu Rasa. Katu Rasa Panchabhotikatva is Vayu and Agni Mahabhut. Hence, the properties of both Mahabhut, including Laghu, Ruksha, Ushna, Tikshna, are incorporated in the Katu Rasa composition. The symptoms told by Ashtahrudaya of Katu Rasa are Udvejati Jivaram Kurvan Chimchimam Katuhu Stravete Akshinasasyam Kapalo Dahati Vacha. So first one is Udvejayati Jivagram. It stimulates the Jivagram. So how we can use it clinically, this symptom particularly? The symptom can be used to stimulate the taste buds when their taste bud capacity of the capacity of taste is hampered. So it gives stimulus to the taste buds and it improves the Ruchi Lakshan by this function. So whenever there is Jiva Vadirya or patient says that there is nothing like any other symptom, but patient particularly tells and I don't feel any taste. See, there is no Sam Jiva in that case, no any other symptoms of GI tract, but the patient feels that this symptom of loss of taste just because of the local subphenomenon happened to the taste buds. So Udvejani Jivagram is useful to improve or to stimulate the taste buds on the tongue when they are affected and their function is hampered without any armor or any GI tract problem. Udvejani Jivagram Kurvan Chimchimam Katuhu. It is again, it produces Chimchimayan. So it is again a nervine stimulus lakshan. Chimchimayan, it's the lakshan because of the nerve stimulation, and so in case of nerve like paralysis of nerves or badhirya because of nerve, Katu Rasa is useful to stimulate the nervine action. Straveti Akshinasasyam. It increases the straw from the sinus and nose and eyes. So it is a very good rasa, useful in the sinusitis. When a patient complains that there is some puffiness and there is some we feel that heaviness because of collection of the mucus in the sinuses or because of pratishay, there is heaviness and patient always says that if I get some sneezing or some, I want that congestion to be relieved, to get it should get secreted out. In that case, always use Katu Rasa. In my practice, I ask the patient to use or to eat any spicy food as he can. When he eats spicy food to optimum level, automatically because of that Katu Rasa action, there is the secretions from the nose and eyes and all this congestion is relieved because of the Katu Rasa. So in food you ask the patient to use Katu Rasa when there is a congestion in the sinuses, in pratishay, etc. So Stravetikshin Asasam Kapalo Dhati Vacha. Now it produces a burning sensation in the mouth. See, this is not the symptom where we can use it because already we are using in Badhirya and so it is nervine stimulus. But Dhati Vacha, you may find the patients because of this Dhati Vacha, there are many chances that excessive of Katu Rasa produces Pitta Prakop and ulcers in the mouth. So whenever there is burning of mouth, especially in the case of mouth ulcers, you always have to find a history where patient is eating a Katuras in a larger quantity. So Katuras, these symptoms of Katuras can be used in the firstly to stimulate the taste buds for their proper functioning in the diseases like sinusitis when there is congestion and patient feels heaviness in the head because of that collected fluid, and in couple of Dahati Vacha you can find the Katuras as a hetu in the case of burning of mouth or in the mostly in the cases of mouth ulcers. So these are the lakshana of the Katurasa. In the mouth, when you apply it, it is always a good ruchikara and deepana a gunadharma. So in the case of aruchi in general, and to ignite the agni, Katurasa can be used to in any form. You can ask the patient to chew the ginger like that, or any Katurasa like Chitrakadivati or Pachaguti, Lakshmanadivati to have that Ruchikara and deepener action. When you chew it in the mouth, the secretions go in the stomach and help for the ignition of the Agni also. So these Lakshana which are mentioned in the text can be used clinically in the patients. In the next episode, we will go to the other functions and Atyava Lakshana of the Katuras. Thank you very much.